Hello, and welcome back to Module 2, Mood Disorders. This is Lecture 2, Depressive and Bipolar Disorders. In the first lecture, we learned about the core experiences of mood disorders, depressive symptoms, and manic symptoms. If a person only struggles with symptoms of depression, they are described as having a unipolar depressive disorder. If they struggle with both symptoms of depression and mania, they are described as having a bipolar disorder. However, there are several different designations of mood disorders within each of these categories. Let's take a few minutes to consider them. When a person struggles with multiple, severe symptoms of depression that are present for at least 2 weeks, they are said to be struggling with major depressive disorder. However, if a person struggles with less intense experiences of depression that are continuously present for at least 2 years, they are experiencing persistent depressive disorder, which is also referred to as dysthymia. Persistent depressive disorder tends to be less debilitating to an individual than major depressive disorder, although it nonetheless has a profound impact on a person's ability to have a satisfying life and meaningful relationships. Seasonal affective disorder, or SAD, occurs when a person experiences all the symptoms of major depressive disorder, but they occur only at certain times of the year, most often from late fall until early in spring in cold climates. Most of the time, people with SAD tend to sleep too much rather than too little, and they tend to gain weight rather than lose it. In the U.S., research indicates that 8% of adults experience severe depressive symptoms in any given year, with an additional 5% experiencing more mild depressive symptoms. Research also tells us that about 1 in 5 adults will experience an episode of depression at some point in their lifetime. Similar rates have been reported in many European countries. Globally, depression has been reported throughout the world, although availability of research data varies considerably from country to country. We do know that people all over the world experience depression. The way a person experiences depression, or in other words, the symptoms they experience and how they describe them, can vary a great deal across continents and cultures. There is strong research evidence that depression impacts women twice as often as it impacts men. Over the course of a lifetime, about 1 in 4 women will experience depression, as opposed to about 1 in 10 men. Depression can occur at any time of life, including childhood and old age. However, it is most commonly found in adults under 65 years of age. The vast majority of people with depression will recover and return to their baseline moods within 6 months after the onset of their symptoms, even if they do not receive treatment. It is very common for people to experience more than one or recurrent episodes of depression. Now let us turn to a more in-depth discussion of bipolar disorder. A person with a bipolar disorder experiences episodes of mania as well as episodes of depression. We refer to 2 forms of bipolar disorder, bipolar I disorder and bipolar II disorder. Both forms include episodes of depression. In bipolar I disorder, people experience full-blown, severe manic episodes. In bipolar II disorder, people experience less severe manic episodes, referred to as hypomania. A person with hypomania generally is better able to function than a person with mania. They may still be able to go to work and attend to their relationships, although they have low or no insight into what is happening and how other people are noticing and reacting to their symptoms. Cyclothymic disorder refers to a manifestation of bipolar illness in which a person rapidly shifts from depressive mood states to manic mood states, although their symptoms never become serious enough that they're diagnosed with bipolar I or bipolar II disorder. A person with cyclothymic disorder generally spends all of their time in either a mild depressive mood state or a mild manic mood state. They rarely, if ever, experience their mood as neutral. They may come across to other people as being moody, and while their mood symptoms never become intense enough to cause serious impairment to their functioning, these rapidly shifting moods may have a negative impact on their lives and their relationships. Now, let us turn to a discussion of the prevalence of bipolar disorders. Bipolar disorders are much less common worldwide than unipolar depressive disorders. Global data indicate that any given time, somewhere between 1% to 2.6% of the world's population is experiencing a bipolar disorder. Lifetime occurrence is estimated at about 4%. Unlike unipolar depression, bipolar I and bipolar II disorders are found equally in men and women. Age of onset for bipolar disorders tends to be between the ages of 15 and 44. If left untreated, the depressive and manic states of a bipolar disorder will remit on their own and continue to recur over time. There is no evidence that bipolar disorder ever disappears completely without treatment.